So hello guys, welcome back to my channel, and this is the third part. We will be covering some important definitions over here. So let's begin. So first, ridge. Ridge is nothing but a linear elevation of on the surface of a tooth, and they are named according to their locations. Like if you see marginal, that is also a location, and triangular ridge. So there are four types: triangular ridge, marginal, transverse, and oblique. So first, the triangular ridge, they are actually present in the posterior teeth only, and these ridges, these descend down from the cusp tip to the center part of the occlusal surface. And marginal teeth, they are found in anterior and posterior teeth both. So in anterior teeth, they are present on the mesial and the distal sides of the margin of the lingual surface. Lingual is which one? The behind, back surface or the palatal surface. And in the posterior teeth, they are found on the occlusal surface, the top one. And transverse, they are formed in the occlusal, in the posterior teeth they are found, and they are found in the occlusal plane, where two triangles they unite and the ridges cross transversely. In this one the ridges cross transversely, and in this one they cross obliquely. That is the only difference. Both are formed by the union of two triangles, but here the ridges of the triangles, that is the sides of the triangle, they cross transversely. You know what is transversely, right? Transverse is like horizontally. Okay, transverse section you might know. Obliquely is slant. Okay, and now coming to the types of fossa. So fossa is nothing but a irregular depression or concavity. Ridges were elevations, remember that. So ridges were linear elevations, while fossas are irregular depressions or concavities. Okay. Now the types of fossas are lingual fossa, central fossa, and triangular fossa. So lingual fossa are, as the word says, lingual side surface. So these fossas are present in the lingual surface of the anterior teeth, that is incisors. As you can see, this shaded part, this is the lingual fossa, okay, a depression. And the central fossa, they are found in posterior teeth. So I have drawn the occlusal, the top view of a molar. Okay, so here they are present on the occlusal surface of molars. So the central fossa, it is formed by the ridges terminating at the center pit. Okay, here at the bottom of the depression near the junction of the grooves. There are some, those develop. We will. I'll just tell you shortly that what are grooves. So nothing but these ridges over here, they terminate at the center pit, this point. Okay, so this is the central fossa. And triangular fossa, similarly they are also present in molars and premolars, and they are present on the mesial and the distal side, and they are triangular in shape. That is why triangular fossa, these. Okay, and they can also be present sometimes in maxillary incisors in the lingual surface. Okay, so that was about fossa. Okay, so now we will be dealing with this. What is a lobe and what is groove, pits, tubercle, sulcus, all this we will be discussing right now. So lobe, it is the primary center of growth, okay, and calcification present during the crown development. What do you understand by this? It is What do you understand by this? So we understand that the main elevations, basically they are formed by this one, not the elevations, basically the cusp, that is the major parts, the bulge parts, they are formed by this lobe. So what do these lobes mature into? They mature into cusps, mammalions and cingulum. Let us see what is a cusp. It is an elevation or mound on the crown portion. This one, as you can see, I have drawn this mini character. So this is a cusp. This elevation, it is a cusp. The eyebrows for that guy. So portion of the tooth making up the divisional part of the occlusal surface. Okay, the top surface, basically they help in dividing the major parts, like the grooves and everything, they are made by this cusp. If there are many cusps, then the grooves are made, or the grooves divide the cusp. Anyway, you can see this. Now what is a mammalion? Any one of the three rounded protuberance, okay, found on the incisal edge of newly erupted incisor. What do you mean by this? Mammalions, it is the front surface, okay, of this crown, and in the incisal ridge over here there are three protuberance. This, it is found in newly erupted teeth only, okay, of a permanent tooth, not found in the milk tooth. They are found in the newly erupted permanent tooth. So this one is called a mammalion. Okay, so there are three mammalions here. And what is a cingulum? Cingulum is very important. It is also called a lingual lobe. Why? Because it is present in the lingual surface of an anterior tooth. Okay, so it is a convexity. Convexity means it's a bulge. So this smiley I have drawn, this is a cingulum present in the cervical third. This is the cervical third. Okay. Incisal third down. This is top is the cervical third. So of a tooth in the cervical third, there is a cingulum present on the lingual surface. Okay, I hope this is clear. Now groove. Groove, it is a shallow line between the primary parts of the tooth, of the crown, okay, or the root. As we saw those primary parts, so these are the lines, shallow lines between them. These were the primary parts, no? The cusp and everything. So there is a cusp here. So this shallow groove are this one which is deeper, it is called the developmental groove, and these small ones like tributaries which are supplementing these developmental grooves, these are called the supplemental grooves. Okay, and these grooves they meet over here, it is the pit. Okay, the junction of the terminal of developmental groove is called a pit. And tubercle, it is a smaller elevation on some portions of the crown produced by the extra formation of enamel. So sometimes there will be extra formation of enamel somewhere on the top, there will be a extra elevation, so that will be called a tubercle. And sulcus is a long depression or a valley in the surface of the tooth between the ridges and cusps. So there is a elevation depression. So this valley, okay, it is called a sulcus. And one more point I want to let you know, height of contour, it is very important. So what is the height of contour? It is nothing but it is the greatest area of contour, that is the outline if you take of a tooth, no? So incisor-cervically, what does incisor-cervically means? Means from cervical to incisal, when you take a measurement, then the greatest height, which part the tooth has, that will be the height of contour on the facial and lingual surface, best observed in the proximal aspect. So here I have drawn a mesial aspect of a tooth. Okay, so in this mesial aspect, this is the labial or the facial side and this is the lingual side. So this convexity you can see. Of course, this will be the height of contour over here because this has the greatest height over here, and the width over here. The labial, in the lingual, this will be cervical, the height of contour. Similarly, in the labial, we can measure and find. It depends on each tooth, it differs. Okay, so here we are finished with the important definitions. Hope you liked the video. Thank you.